What's going on, guys? Welcome to another episode of Healthspan Academy. I'm your host, Craig Shearhart, and joining me today is Dr. Emily Splichal, who is a podiatrist. We're going to talk about feet stuff today. She started her academic career with a Bachelor of Science in Biology and Forensics from Hamline University, completed a doctorate in pediatric medicine from New York's College of Pediatric Medicine, and then completed a Master's of Science in Human Movement from A.T. Still University, and then did a fellowship in functional medicine from George Washington University. She's got 5 years of experience as a podiatrist and foot and ankle surgeon with Grey Mercy Park Podiatry. She's the CEO and founder of EBFAS Global, which is an education platform for foot mechanics. And she's a functional podiatrist currently with the Center of Functional and Regenerative Pediatric Medicine. She's a CEO and founder of Naboso Technology, and she's the author of Barefoot Strong, which is a great read. So today's all about foot mechanics and keeping our feet functioning as long as the rest of us. Dr. Emily, thanks for joining me today.
Thank you so much. I'm excited to talk about feet.
Amazing. So I want to start this off with how you kind of get interested in feet and function and their mechanics, and how did that all come about?
Yeah, a big part of my background that set the tone to how I now practice and really appreciate human movement is that I was a gymnast for 13 years. That was a big part of what just kind of instilled certain characteristics in me. Yeah. It happened to be a barefoot sport, which now really focusing on barefoot movement is quite interesting. Yeah. And then I went from my bachelor's into fitness. Huh. And part of that was I was doing forensic science in New York City and was very unhappy sitting in a lab when I just wanted to move. When you're a mover, you want to move. Yeah, I feel I had this itch to be moving. So I actually left forensics and went into fitness, became a personal trainer, group exercise instructor, ultimately wanted to get an advanced degree. So I started looking at medicine. Cool. I knew that any aspect of medicine, I really needed to be able to integrate fitness and movement into it. Right. Which is why I eventually chose podiatry. Yeah. And this podiatry foot perspective with my appreciation for fitness was good, but it wasn't complete. I felt like something was still missing. Right. And then that's why I went back to school to get my master's in human movement. That then became really the glue between the two specialties or passions. Cool. And then the last part that you had mentioned about anti-aging medicine and regenerative medicine, that has been the evolution of how I take these three into my practice now. So I try to bring a longevity perspective into everything that I do, specifically movement longevity.
That's amazing. Cool. Well, I'm excited to talk about all these things. So you talk a lot about feet, and obviously that's our shoes, I should say, kind of in the book. And that's like I think there's a lot of kind of split kind of like doctrine around how we select ideal shoes versus, minimalist versus kind of cushioned heels, especially we talk about running. Talk through how you would advise someone to pick a pair of shoes, kind of activity to activity. What are the general questions you get them to kind of ask when they're starting to shop around for shoes?
Yeah. So when looking at shoes, you always want to match your foot type, which is everyone's own personalized foot type, with the activity they're doing, which will indicate the stress that you're going to be putting your foot under, with the level of recovery you integrate, so the compliancy of your foot recovery, and then your injury history. Right. For most people, and in certain situations, I would love to have everyone gravitate towards a more natural, minimal shoe that is very flexible, has minimal cushioning or no cushioning, no heel toe drop, something that's going to support maximal sensory stimulation with freedom of foot movement. Right. However, not everyone can tolerate that because of their foot type, their foot strength, their lack of compliancy to do foot recovery, or maybe they have certain injuries, recurring plantar fasciitis or post-tib tendonitis, certain things that don't support that footwear. Right. However, there are really good transitional shoes that are not too supportive and not too minimal. And that's where I try to put as many people as possible. Right. And then I actually teach patients how to build up the shoe with little foot pads, so we can take a more minimal shoe, not go into a big, bulky orthotic, but maybe meet in the middle with a foot pad to support the medial arch or the heel and things like that.
Right. So you kind of like meet them where they're at. Basically, if they've been accustomed to this massive heel, excuse me, you wouldn't like go, okay, let's go barefoot or socks or whatever. You're kind of like taking a look at where they're at and sort of guiding them along that path towards minimal to the point where they can tolerate it. That's kind of the gist of it?
Yes. And then that transition from supportive to transitional to minimal, or wherever that individual wants to go, is built off of building sufficient foot strength and balancing it with sufficient foot recovery. So
right.
Strength and recovery have to be the components of everyone's really healthy foot lifestyle.
Right.
And that is really where a lot of the injuries were seen back in 2008, 9, 10, this barefoot running boom, minimal shoe boom, was that a lot of people were not thinking about strength and recovery. They just thought that the shoe was the way to strengthen the feet. And that's not necessarily the case.
Yeah. And I guess the other issue is if you're going barefoot and you're pounding the pavement, it's just a bit of a jarring transition, which I'm assuming that factors in. Let's talk about the mechanism for fallen arches. That's a common thing. And I think we'll talk a little bit more about orthotics in a bit, but why is it mostly like hip dysfunction, or it's just genetic, or why is it so common basically for people to end up with fallen arches?
So fallen arches or flat feet, this is where I like to educate the general public, consumers, patients, right, about the many different types of flat feet that are out there. Just to say flat feet or fallen arches is very vague.
Right.
I would like a little bit of specificity behind that.
Yeah.
Meaning that typically when I look at flat feet, we'll just call it flat feet for now, I am starting to characterize it in certain ways.
Right.
There's two initial types of flat feet that you can think about, and the listeners can start looking at their feet and see if they might have this, is that when you sit in a chair, which is open chain, and you stick your foot straight out, can you see an arch, right? Do you have this potential to create a beautiful arch when you're not on your feet? No gravity, no body weight.
Right.
If you do, and then you stand up and it goes boom, and it drops down, now we're talking about a certain type of flat foot. Flexible is where you start to put it. This flexible flat foot, and there's several types of flexible flat feet.
Right.
It could be either an element of strength or an element of ligament laxity.
Right.
Now, the strength, we're talking about small foot muscle strength. Posterior tibialis is the most important dynamic arch stabilizer. And it runs from the bottom of your foot around the inside of your calf to then your core to your glutes. So it could be anywhere along that chain.
Right.
Yeah. The other type of the ligament laxity, this is where I will give people, it's genetic.
Yeah.
Okay? Normally I don't like it's genetic with anything.
Yeah.
But with flexible flat feet that is related to ligament laxity, you now have a genetic propensity to having very elastic properties within your ligaments and your tendons and your fascia.
Right.
That part is genetic, which can predispose people to bunions.
Yeah.
And that's where people would say, oh, the bunion is genetic. What I say is the bunion isn't genetic. It is the ligament laxity that led to the flexible flat foot and lack of stability that allowed the bunion to form. So those are two types. So we have flexible flat feet strength, flexible flat feet ligament laxity. And then if we go back to the top where we said, you're looking at your feet, do you see an arch or no? If someone looks at their foot open chain and there's no arch, now we have a rigid flat foot. And if you don't have an arch when you're sitting in a chair, you are not going to have an arch when you stand up on your feet.
That's fair.
Type.
I love that. So out of those two cases, is there one that's more prone to pronators, or are they kind of like, is it kind of synonymous? Because you talk about bunion, I just think of pronating. Is there like toe offing while they're running or walking even?
Yeah. So from a statistical study, I would have to look at the research as far as, which type is the most prevalent.
Right.
What I will say is, and actually, let me go back one so that your listeners have even more information.
Sure.
Is the rigid flat foot This is what makes feet so fascinating, is that it is so detailed like this. So rigid flat feet can actually be broken down to two more.
Right.
The rigid flat foot, the first one is going to be what I call a pancake foot. This is a foot that is flat.
That's a great image.
Born flat. The bones are parallel. So if I look at an X-ray of a pancake foot, the bones are parallel to the floor. You don't have this incline, decline that creates a beautiful arch.
Right.
They're parallel.
Yeah.
That's a rigid flat foot. That is a pancake foot.
Mm-hmm.
That is one that is really genetic or really built within their foot anatomy at birth. It's part of their structure.
Yeah.
Second type of a rigid flat foot is a progression of these flexible guys over here.
Mm-hmm.
And it's usually this end stage progression, arthritis, breakdown of the connective tissue that leads to a rigid, overpronated flat foot. So it's like the end stage of the flexible guys over there.
Okay.
Of all of those, probably the most common that I see, it's going to be the flexible ones, and it's probably split between both of them.
Okay.
I would say an even split between ligament laxity and strength.
Fair enough. So they're both prone to it kind of in the same proportion, I guess. Cool. Let's talk a little bit about how we start to correct that. So, I mean, the ligament's probably a lot more complex. So when we talk about the other case where it's just like, maybe it's muscular, is the most key thing like strengthening the actual muscles around the arch? Is it more hips? Is it a combination? Is it case to case? Or what's the best place for people to start correcting that if they do have an issue?
I'm going to try to not say this in a complicated way, but guess what? We can break it down even more.
Okay, fair enough.
There's even more types of this. I'm seeing a flow chart in my mind.
Yeah.
So with your flexible flat foot that is strength based,
right.
Okay, there's a joint in the back of the foot called the subtalar joint.
Yeah.
This is the heel bone that can kind of roll out and roll in.
Mm-hmm.
That joint of the heel bone subtalar joint, outside, inside, is greatly influenced by the glutes.
Mm-hmm.
So if I see a little bit of a collapsing in the heel and that joint, I will then have that patient for sure make sure they are strengthening their glutes.
Right.
And the way that you can do a glute test to assess, are the glutes strong and controlling this joint, this heel in the foot, is that if you go from 2 feet and you're standing relaxed, so bilateral, both feet relaxed, and you see a little bit of drop in your heels, that's a passive position. Your glutes are kind of relaxed.
Right.
When you go into a single leg stance, that is considered active, and I need your glutes engaging. This is a glute test.
Yeah.
Strong glutes will be able to take a heel that's a little bit collapsed when you're standing on both feet. Mm-hmm. And as you shift onto one leg, it will be able to pull that heel into a beautiful, neutral, straight position.
Right. And that's like, are we talking more, I'm thinking like, is that more external rotation? Are we talking hip extension, or what exactly, if we nail down that glute function, if we connect the chain, what's the action of the glute in that position?
Yeah, it's the external rotation moment.
Yeah. Okay.
So it's externally rotating. And when you rotate your hips out, like what your glutes do, if the listeners kind of squeeze their butt in a sense, you rotate out, that's going to pull the calcaneus into inversion or the outside, which will put it in neutral.
Right.
So that's where when I assess a foot and I see pronation in the heel, for sure, glute strengthening. Yeah. Of course, everyone's strengthening their feet, but it's really based off of that hip strength. Mm-hmm. For the listeners, your glutes are only as strong as your core is stable, right? Which means I need to be giving these patients core stabilization exercises first, and then I build glute strength off of that.
Yeah.
Or the really foot specific one, and this other type of flat foot and foot strengthening approach that I have is there's a type of flat foot where the middle of the foot kind of spills in. There's a bone there called the navicular. And when it really drops down, that's more of a middle of the foot pronation. Yeah. And that's going to be more posterior tibialis strengthening versus glute strengthening. Obviously, we still do glute strengthening. Yeah. But to tie in post-tib strengthening, I'm looking at the middle of the foot. And if I see that in a patient, I'm giving them a lot of post-tib exercises.
Right.
A really good one for the listeners is put like a lacrosse ball between your heel bones, and you push your heels into the lacrosse ball and then do calf raises. Cool. That is a really good post-tib exercise.
Awesome. Sweet. Very cool. So this is somewhat biased to my own kind of pathology, but I've suffered a little bit with turf toe over the years. I want to talk about, get your take on that. So what are the common root issues? Is there often like a hip issue going on with turf toe? Is it specific to the foot? Is it like, are there too many variables to kind of talk about? Or what is the most common root issue if we start talking about turf toe issues?
Yeah, the easiest way I'm going to explain turf toe for the listeners is that everyone can get turf toe, not just athletes on a field.
Yeah.
I don't know how you had yours. Maybe you were like kicking like soccer, football, things like that. And you essentially
it's
get
something way less interesting than that.
Okay. I have many patients that do it in their home. They kick a piece of furniture or jam a door, something like that. It is essentially a jamming, a compression of the big toe joint into the toe, right? So it's a compressive injury. Mm-hmm. That is a accelerant, a trigger to arthritis formation.
Right.
And a lot of patients don't understand that trauma to a joint is essentially like lighting the match to arthritis to occur.
Right.
And the science behind that is inflammation around a joint specifically. So we'll just talk about inflammation around a joint, like the big toe. You jammed it, it's inflamed, it's red, it's painful when you move it. There's inflammation in there. Yeah. Inflammation causes stickiness and what's called capsular contractures. So the joint just went like this. It pulled in really tight.
Yeah.
So now you have a stiff joint that is sticky and kind of contracting and pulling in. That combined with kind of antalgic gait and compensating a little bit, you just start to create this cycle of uncontrolled stress into the joint itself.
Right.
And then you can start to break down the cartilage.
Yeah.
When I look at turf toe, I'm really not, I always think about the hip, but strengthening the glutes isn't going to reverse this acute compressive force that happened on the joint. Yeah. So for that, I actually will look and modify shoes in a certain way. I'm not a fan of Hoka, but Hoka and their rocker component really does help these patients or these individuals with turf toe.
Yeah.
Hopefully it's transient, but it is something that I will recommend to patients so that they can take stress off of that joint by rocking through the shoe versus the joint itself.
Mm-hmm. I love that. Is like a simple distraction helpful in that case? If it is just literally jammed in and just like opening up the joint space, is that something you'd prescribe, or is that oversimplification?
Yes, you can absolutely stretch the joint. Yeah. And if the listeners don't know what a distraction is right. You're stretching the joint, you're opening it up, creating space. You do want to do that, not just one time, but I tell patients to do it, every night for several months. You can kind of massage in like a CBD oil or whatever topical you might want to use. Yeah. Right. Kind of massage it in and then stretch the joint and hold, create space. You'll typically notice like a puckering, like you can see the joint will pucker a little bit. And that's totally fine. You're not going to tear the toe off. It's stable, right? So you can pull, decently strong to open up that joint, but you're trying to stretch the capsule. So like any stretch, you want to hold it and allow space and time and
like
kind of stretching along that.
Is like the 2 minute time domain, like the standard for that, or what? Yeah, 2 minutes. Fair enough. And can you overdo that? Can you can you get into like joint laxity issues if you over distract it?
I actually have not seen that. So I don't think so.
You probably have to be pretty obsessive compulsive if you go to that point.
Well, yeah, I have many type A patients. Oh, yes.
Fair enough. Amazing. So I've seen you post quite a bit about toe spacers, and they just seem to be blowing up on my social media feed. I don't know if that's just like coincidental or what. So obviously there's some benefit to them. Are these like fairly universally beneficial, or are they specific to people who are just like literally crushing their toes in stilettos, or like just toes or shoes with small toe boxes? Is it something that everyone can benefit to some degree?
I am in love with toe spacers.
Yeah.
And for listeners with the video, those that are seeing it, I have some that I'm showing here.
Cool.
The toe spacers that I think historically people thought of toe spacers as like, okay, you're getting a pedicure, right? So it's a really kind of one application. Then it became, oh, I have a bunion or hammer toes. So it's kind of the next evolution of it. To then, oh, I wear tight shoes or stilettos, dress shoes, narrow all day. Okay. But now suddenly you're getting this, boom or whatnot within the health, wellness, fitness, CrossFit kind of space. Yeah. And I think people are appreciating what toe spacers can do to natural foot alignment, splay, or the spreading of the digits in the ball of the foot is a really important part of how we build stability. Right. You can actually stretch your plantar fascia by spreading your toes. It's a plantar fascia stretch because that's where your plantar fascia inserts. So that's awesome. I recommend toe spacers to people for balance issues or to improve balance, because your toes contacting or purchasing the ground. Yep. Toe flexor strength is really important to stability. So this will support natural toe flexor strength. Right. And then, people are just digging foot recovery lately, and I love it.
That's awesome. So let's talk a little bit about other foot disorders. Are you seeing a rise of other kind of pathologies? Does the pandemic change things, with like stress issues that kind of resonate around in the feet, or what are the issues that you're seeing more of in the last few years?
I will share an interesting one for your listeners that relates to COVID. I know everyone wanted to talk about that at some point. Is for people who have had COVID and some of the vaccines, is I have seen patients with different neuritises. Okay. So when we get a high inflammatory storm, a cytokine storm that they would reference, and then some of the medications do, or the vaccines increase inflammation, right? Because it's trying to mimic the response of the COVID infection, is that they would feel like a buzzing or a burning or like a fasciculation, tingling, almost like a restless leg type symptom through their leg and their foot. Right. And they would kind of consult with me and say, does this make sense? Right. And actually, yes, I have seen and heard, and there's research around inflammation causing an effect on the peripheral nerves. Majority of them are transient. So almost like some of the research around Guillain-Barré. So Johnson & Johnson had this Guillain-Barré association or side effect, which is a autoimmune inflammatory response to the nervous system. Right. And that is something that I have seen since this pandemic. If I do see that in a patient, I focus on red light therapy, GABA supplements, L-theanine, things that are calming to the nervous system, CBD, just saying neuroprotective on that. Other side of where I've seen pandemic associated shifts in foot pain would be people who work from home and have restructured their work environment to be more of like a standing desk. Right. I feel that since you now have control of your office or workspace, many people are probably now like, hey, this is my chance to get a standing desk. I want to, be creative in that. Yeah. I see many. I feel
like, wait a minute, what's going on here? I'm not used to it.
Right. As I'm sitting too. Yeah. Many plantar fasciitis and Achilles tendonitis in standing desks workers.
Interesting.
Because standing is just as stressful on our body as sitting, but obviously in a different way. Yeah. So for that, I would say, you want to make sure that you're releasing your feet consistently, be a fidgeter, get the different standing desk mats that you can kind of release on ridges that are built into it. Yeah. Have a lacrosse ball at your desk so you constantly can be releasing the feet.
Right. So when you mentioned Achilles, that's interesting. I never would have thought about it. But is that just more because the calf is more active when you're standing? Is it just kind of like, and it tends to shorten it? Interesting. Yeah. That's wild. I never would have thought of that. Very cool. I want to talk about your foot to core activation cascade you talk about in the book. Is this I kind of went off because I think of like functional. We always think of core to extremity, but this is kind of the reverse direction. So you talk about short foot activation to deep hip activation to glute engagement. Talk through that process and why it's effective in improving the overall foot kind of mechanics.
Yeah. So our feet are connected to our core in several ways.
Right.
4 ways I could share with you. Your foot, you can think about the human foot as our foundation to our body, to our posture, right? It's our base.
Mm-hmm.
If your base is not stable and supported, the rest of the structure is not going to be strong and supportive, right?
Mm-hmm.
Kind of like a foundation of a building.
Yeah.
Every movement that our foot does influences the lower leg, femur, hip, pelvis. We spoke about that a little bit with kind of the standing and the flat feet and how I correct it.
Mm-hmm.
So if you have a pronated foot, you kind of collapse in, that internal rotation can start to make the glutes and the core weaker.
Right.
As your leg rotates in, your pelvis rolls forward into an anterior tilt, and that can actually deactivate or make it very difficult to engage the pelvic floor.
Right. Yeah.
So mechanically or kinematics, your foot is connected to the pelvis, which influences core strength. To add on to that, your foot as the contact point between the body and the ground is important to how we transfer impact forces. So when we think about movement and gravity, how we relate to gravity is based off of your center of mass, which is going to be around your pelvis. L5S1 is your center of gravity. Your center of gravity is stabilized by your core muscles, right? Your deep core. I'm going to reference pelvic floor a lot. So pelvic floor muscles.
Yeah.
So if you have your center of mass stabilized by your pelvic floor, it then needs to be connected to your structure's other contact point with gravity, which is the ground or the foot.
Right.
So from a gravitational human movement perspective, you need the foot ground connecting to your center of mass.
Right.
And so that's another way. Now, how they connect to each other from actual stabilization is through a fascial line. So fascial lines are lines of muscles in the body that are connected by connective tissue, fascia. There's one that's called the deep front line, which runs from the tips of the toes, the deep muscles in the bottom of the foot, through your lower leg, into your inner thigh, to your pelvic floor, diaphragm, and it runs up even to your tongue. So that connection, if I can teach someone to engage their foot muscles while lifting their pelvic floor and exhaling or putting the tongue to their pellet, I've essentially stacked or activated this fascial line.
Right.
It's actually how we maintain posture is through this deep, soft tissue skeleton is how I think about it.
Yeah.
So that's your foot to core. There's the appreciation of conceptually understanding gravity and center of mass and how we move around gravity. And then there's the kinematic one, which is the kind of joint coupling, rotation, external rotation, pelvis moving. And then the last one just for you is that there's what's called a muscle synergy that it shows in the brain through fMRI. So it lights up different parts of the brain. When you engage the big toe down, your posterior pelvic floor will actually activate. So it's a muscle synergy. Yeah. Very which cool. Is super cool. And it is essentially supporting these other 3 ways that I just demonstrated it. So every single one of my patients is getting foot to core sequencing strategies or programming when they come into my office, whether they have plantar fasciitis, they have knee pain, low back pain, pelvic floor issues, first MPJ. It's all connected and we need to train it as such.
That's wild. When you talk about the big toe, we cue that when basically we cue squatting. And I've like my rationale is just creating the tripod in the foot, but that fact that it kind of creates this synergy with the core is I never would have thought of that in a million years, but it makes total sense.
Yeah.
And it's just a cool bonus, I guess, with that cue.
Yeah, exactly.
Cool. I love that. You talk quite a bit about impact forces in the book as well. And when I think of impact forces, I think like happy dose, right? Our joints need some load, our bones, our muscles, our joints But obviously if we overdo it, we run into issues. How do you tell people to sort of figure out what that happy dose is? Is it just kind of listening to your body in terms of like recovery, soreness, DOMS, or how do you know specifically if you've got the right impact force on your foot, especially for a runner, I guess? How do you start to talk someone through that?
Yeah. So impact forces, the way that I like to first establish this is that ground reaction forces or impact forces are a positive. Mm-hmm. It is necessary. Yeah. It is actually your body's energy to take the next step. Mm-hmm. Most people think about impact forces from a negative perspective because of running shoe companies and everyone wanting me to say, okay, impact forces are what cause running related injuries.
I'll be running on clouds.
Yeah, exactly. Unfortunately, it doesn't work. So impact forces are your body's energy. In order to utilize that energy, you need to be able to perceive the impact, be able to store it, like absorb it and store it, and then be able to release it effectively. So it's this whole process. That is really built around your shoes that allow you to feel the impact forces, having the capacity within your myofascial system to absorb them. So it's isometric contractions. For that, you need to train your foot to be fast. So when I train patients and athletes, I train very rapid isometric foot to core contractions because that's how you load it. So it's creating that. And then you have to have the elasticity within your connective tissue to be like a rubber band.
Right.
As you get older, you're dehydrated, you don't take care of your tissue, you don't have the capacity to be a rubber band.
Yeah.
And then you start to compensate and get injured. So all of that's really important.
Yeah.
Where the overload can happen, which does occur because that's what an overuse injury is based off of this concept of a tissue stress threshold.
Right.
Every tissue in the body has a certain threshold of stress. You go past it, you break down.
Yeah.
So we're all trying to like ride the line of the threshold. Don't pass it, right? You can ride the line, but don't go over it.
Yeah.
That is based off of strength, technique, awareness, recovery, dosage, right? All of that stuff. Yeah. If we do not train our feet, we do not wear proper shoes, we do not do foot recovery or tissue recovery, we do not take care of our body from a stress level and a hydration and diet, all of those things start to affect how you push closer and closer to that stress threshold.
Yeah.
So typically when someone is getting close to the threshold where you were saying, how do you know when you're getting too much impact? Is the body will start to talk to you, right? You might be like, okay, I'm starting to feel a little noise in my heel. My plantar fascia is starting to talk to me. Don't ignore it.
Yeah.
You got to listen to it.
Yeah.
And one of the best ways to listen to the body that is talking to you is to give a couple days off.
Yeah.
Right. Get past this inflammatory window and allow your body to get to the next phase of tissue healing. Get out of the inflammatory phase or the phase 1.
Right.
And then you can re-stress it, but make sure you are always listening to the body and doing everything else that I spoke about.
Yeah.
But where I find most people, especially runners, because runners love to run and don't want anything to stop them from running, is that they try to push past it.
Yeah.
There's that whole saying of no pain, no gain, which I'm not a fan of, because once you get your first injury, you kind of open Pandora's box.
Yeah,
and you don't want to do that. It's a slippery slope.
Yeah, for sure.
So avoiding that first injury is really important.
Yeah, I fully agree. That's a great description. I love that. So along the impact forces, you talk a lot about unnatural surfaces and how they can make an issue. So talk through what are some of the issues? How do we know that's going to be an issue if it's we're being impacted by unnatural sources, and how do we sort of minimize the effect there?
Yeah, every surface vibrates differently.
Yeah.
Or provides different characteristics of impact forces. And I had mentioned vibration. So impact forces are actually perceived as vibration. That's really important for the listeners to understand that. So as these vibrations are coming into your body, you want to have the perfect amount of vibration. It's actually a frequency. So you want to have the appropriate frequency of vibration coming in so that you can absorb it effectively and then use it as potential energy in the rest of the way that I had just explained.
Right.
Now, certain surfaces like concrete, tile, marble, things like that do not vibrate in themselves, which when we are moving dynamically on a surface, we want to have a symbiotic relationship with the surface.
Yeah.
That means as your foot is striking the ground, so here's your foot, this is the ground, you're striking the ground. You need both of you to vibrate. They have to vibrate, the ground, and you vibrate.
Yeah.
Okay. This symbiotic relationship.
Sure.
On surfaces like concrete, you strike the concrete, it does not vibrate. So you are getting kind of this, right? You can almost think like a cartoon that like hits a wall and then it back reverberates into them.
Yeah.
That's essentially what's happening, right? Is that you're getting this overload of vibration into your system. And now you're going to fatigue and hit that threshold faster because the dosage is higher than it should be for that activity.
Yeah.
The ways that you can kind of offset that, cushion in shoes. Not a big fan of cushion in shoes, but really cushion in shoes on, say, concrete is going to take away some of that excess vibration that's coming in. Compression sleeves. I really like these, especially for runners that have to run on surfaces that are not ideal. Yeah. The compression sleeve can offset some of that vibration, is really good. Or really look for surfaces that are going to provide a more dialed in dosage of vibration. Trail, dirt. Really treadmills are better because they're controlled vibration. And then one of my favorite is an indoor track. Indoor tracks are tuned to provide this precise level of vibration to the athlete.
Depending on the impact.
Yeah.
Love that. Cool. So you kind of alluded to this a little bit when we talked about like recovery, and you talk quite a bit about nutrition actually in the book as well. What are the key factors? Is it just like, minimally processed, nutrient dense foods, or are there specific things we need to talk about when we're trying to optimize foot function in terms of our nutrition?
When I think about foot function and nutrition, I'm thinking about inflammation. Systemic inflammation. So any foods that are going to be pro-inflammatory, fried food, right? Sugars, things like that, because inflammation is very toxic to connective tissue. It's very toxic to our nerves, and it's toxic to our blood vessels. So anything that is going to compromise the elasticity and the hydration and the cross-linking of my connective tissue is going to affect my rubber band effect. Anything that affects the nerves is going to affect my sensation of my foot, right? So perception, balance, all of that. And then whatever is going to affect the blood vessels is going to affect what's called microcirculation. So teeny tiny blood vessels that supply the skin, the nerves, the tissue, the fascia, the muscles. All of that needs to be really healthy or supported for optimal foot function. And a lot of that is diet-based and inflammatory-based. I
love that. Dr. Emily, I want to kind of shift into your current services and focus for the next year. You got tons of stuff going on. You're involved with so many things. It took me like 10 minutes just to list your activities. What is your main focus for the rest of 2022?
99% of my time is focused on Naboso. And for the listeners, Naboso is a sensory product line that I developed 4 years ago as a way to help people access the power of the human foot and the way they connect to movement. So essentially what that means is all of our products, if any of the listeners on the video, all of our products have texture on them. This texture is designed to stimulate the nerves in the bottom of the feet and the palm of the hand. We have insoles, socks, mats, flooring, release tools, sticks, other products that we're developing. And it really is to optimize literally everything that we spoke about. So from activation, foot strength, recovery, blood flow, neurostimulation, perception of the ground, impact forces, literally everything is based off of how well you can feel your feet, the timing. So how quickly can you feel your feet? What is the recovery? So our products are great for recovery. and really that neurostimulation as well. So reducing falls, optimizing balance, and the way that people are walking. That's the majority of my 22 trade shows are open again. I'm so excited.
Sure enough. That is exciting.
Trade shows. So summer is conference season.
Yeah.
So I will be this whole summer, every other weekend, I'm at another conference speaking and doing a trade show.
That's awesome. Yeah. I saw that you're on the Functional Aging Institute with so.
Yes, that
really
is
cool.
in 2 weeks.
Yeah. I chatted with him a few months ago. That was a really cool chat. Amazing. So Emily, I want to talk about your personal health and wellness priorities. Obviously, the foot is kind of your jam. Is that your main focus? Or you have other issues like in terms of your health, longevity? What's at the top of the list of priorities for you right now?
For me personally?
Yeah.
So obviously feet movement, recovery, optimization. I'm all about that. Whenever I train and focus on my personal opinion of optimizing how I move is based off of body weight training. So I'm a big believer in body weight training.
Yeah.
I also happen to not be an aerialist. I'll call myself an aerialist, but I train in aerials, which is really important to me because I like to choose a movement practice that forces me in the present moment. So that's also what I'm focused on is things that force me into the present moment because I'm so busy during my day building a company that is so in the future that if I don't do something that anchors me in the now, it's very anxiety inducing to be in the future. That's what anxiety is.
Yeah.
So I try to enjoy every moment in the present moment.
Yeah.
Practices such as aerials for me is what that does. Other aspect of what I focus on is really anything that is personal development from an intellectual standpoint. Right. So is that reading certain books? It's really hard for me to read because I'm like on the computer 12 hours a day. So at the end of the day, I'm like, I don't want to, but I am a podcast junkie. I am obsessed with podcasts. Awesome. I know you love that because you want people out there loving the podcast.
For sure.
But yeah, I'm totally obsessed with podcasts.
I love that. Amazing. Well, this has been an amazing chat. Emily, appreciate it. What's the best place for people to follow your content?
Yeah, on Instagram, my handle is dremilydpm. So dremilydpm. Naboso is NABOSO_technology. And then my website for my podiatry practice is my name. So dremilysplichal.com.
Cool.
For my book that you had mentioned, it is available on Amazon. It can also link through barefootstrong.com. There's also a foot type quiz. So we were talking about that a little bit on foot types.
Yeah, cool.
The listeners can take their own foot type quiz. And then for any of the Naboso products, it is naboso.com, naboso.com.
Amazing. Well, we'll link to all your goodies in the show notes. Thanks again for the time. This has been unbelievable. Appreciate it.
Oh, of course. Thank you so much.
All right. Thanks for tuning in this episode of Healthspan Academy, guys. We'll see you next time. Hey, what's up, guys? Thanks for tuning in today. Hope you enjoyed the episode. Thank you so much for supporting this channel. This has been a fun project. We're growing in viewership every single week, and we obviously couldn't do that without you. So thank you for continuing to tune in. I really hope you're getting value out of the programming and the content. Just wanted to give you a heads up. I've been working on a book on health and longevity the last couple of years, been collaborating with my colleague, Dr. Dan Vitale, who's an expert in the field as well. And we've basically just kind of summarized the literature, some of the techniques that we found really useful in the world of biohacking, what our exercise regimen looks like, what's, cardio type stuff is going to help us live longer and healthier, mobility work, nutrition. We've covered the whole spectrum, everything that you can basically be in control of in your health and fitness kind of moving forward to help you live as healthily as possible for as long as possible. And it's available free for download. So if you click on the YouTube banner, you'll see a link to download the blueprint. It's also on our Instagram profile or on the website. You can click on 5pillarmethod.com/optimize to get your free copy of the book. And I hope you enjoy it. Hope you're keeping well. Thanks again for tuning in, and we'll see you next time.